Thank you so much for coming after work. I know as a fellow pharmacist, after a long day of dispensing and dealing with people, it can be a bit much, but so thanks for making the trek out here. So as Margaret was saying, I am the marketing manager for Vank Pharm. I'm kind of a jack of all trades, so I have been the only sales rep since May of 2015 when we launched. But I actually am happy to say that we just hired our new territory sales manager who is here tonight. So I'd like to introduce everybody to Eric. So Eric, if you could just stand. And Priti Suri is here. So she is our guest speaker for tonight, and she is a dietitian. We worked on a project together called ICON. Not sure if you guys have heard of it. It's through UBC, and it was part of their e-health initiative. So Intercultural Online Health Network. So that's where we met a few years ago. So I reached out to Priti and I thought it would be great for pharmacists to get to hear a dietitian's perspective on anemia. And so just a little quick history on Vank Pharm. So Vank Pharm, because it's based out of Vancouver. So we are Canada's only pharmaceutical company based out of Western Canada. We're also the only pharmaceutical company in Canada that has a pharmacist at the head of it, yours truly. And so we do have our generic portfolio, and as of April 1st, actually all of our Vank Pharm products became formulary covered molecules, which is great. And we launched our OTCs in December and in February, so which brings us here. So any questions, please feel free to ask me or Eric, and enjoy the evening. Thank you.
Thank you, Pindi, for introducing me briefly. My name is Priti. I'm a dietitian. And here I am talking a little bit about anemia and iron. And a lot of you will know this as a background, and I'm sure you studied it and deal with it quite often in your practice. But a lot of things will be a refresher, sometimes a new thing, and we'll be able to brush up on things that we sometimes miss in a mist of practice. So just a bit of introduction on me, on who I am. I'm registered with the College of Dietitians here in BC, and my specialization is in clinical dietetics. And I'm a chief consulting dietitian at Diet Group. So moving on to the presentations, I'm sure you don't want to know too much about me, but more about iron. So we are here to talk about iron. So what are our objectives, or what are we going to learn from today's presentation? We'll talk in detail about iron-deficiency anemia. So anemia is a very broad term, and we're going to focus more on iron-deficiency anemia and what it is, and gain better understanding of it. What causes the iron deficiency anemia, and what are our treatment options for people who have this kind of a condition. The two treatment options, basically the non-drug treatment, where a lot of times dietitians step in, and the iron supplementation. So we'll get into details of all that. So seems very simple. That's what we're going to try and achieve for tonight. And here we go. So what does come to your mind when you think about anemia? Any ideas? Did we have anything that helps with anemia in the falling hair, fatigue? Yeah, many things. So it's a broad spectrum of things that come to mind when you're thinking of anemia. And as I said, it's sometimes a very loosely used term. So getting into more specifics, people typically think of a blood test the moment you talk about anemia, saying, "Oh, I'm going to need a blood test," or what. Pale skin, people usually look more on the yellower side, or they don't have that pinkish pallor in their skin. Fatigue, as we came up with a few times. Shortness of breath happens very often. So, when you see clients who are like, I'm getting a lot of shortness of breath with short walks, going up the stairs, that tends to happen in anemia. Iron products come to mind as to what am I going to take, or what am I going to do to get my anemia resolved. And red meat comes to mind quite often, because most people know and have been able to associate saying red meat's going to give you iron, which is linked to anemia. So what is iron? Everybody knows. It is a metal. Yes, you're right. Thinking more on the nutrition and medical sides of iron, it is an essential micronutrient. So food, as we know, is broken down into nutrients, micronutrient and macronutrients. Macronutrient, most talked about calories and fat. Everybody knows about it, deals with it daily in and out of their lives. Micronutrients are more of the smaller quantities needed in our body, but they have very essential functions, and that's what run our body and the cell functions. Iron is an essential micronutrient, meaning to say body cannot make its own, so we need to provide it either via food or pills or whatever be the case. It's also very important because it is a part of hemoglobin, which is important to transport oxygen through our body. We've dealt with this a lot of times in our practice. We know that when our hemoglobin is low, as we talked about in anemia, our hemoglobin is low, oxygen is not able to transport and walk through our body enough. Also, hemoglobin synthesis, the balance and in the balance of how much iron is going to be taken up and absorbed in our body and how low your stores are is always in a balance. The lower the stores, the more your body is going to absorb because it is essential for your body to need it. Where does it store? Just to know as a bit of a background, where iron is stored in your body, your liver, spleen, and your bone marrow. Why is iron important in our body? I'll touch on a few things, elaborate a little bit more about that. We all know that blood in our body is very important. It performs multiple functions. And of these functions, one of the few functions that are very important would be delivering oxygen to all the parts of the body and picking up the carbon dioxide and releasing it back. That's what we do while breathing. Breathe in the air, the oxygen is taken to different parts of the body, whatever is left over, not needed, carbon dioxide is removed. And blood performs that function of taking that oxygen to the different parts of the body. Blood is made of blood cells, as one may know. Blood cells have two major parts of it, erythrocytes, the red blood cells, and leukocytes, the white blood cells. We're going to focus more on the red blood cells today because that's where our iron is housed, and that's what we're trying to talk about here. So erythrocytes, the red blood cells, have an iron protein compound in them that's known as hemoglobin, and that's what you touched on saying when your hemoglobin's low, you have anemia. What that hemoglobin basically does is it takes up the oxygen that you breathe in, and it takes it, holds on to it, and travels to different parts of your body and gives it to the cells that needs it. So that hemoglobin is responsible for the travel of the the travel of the oxygen. And iron is essential for this hemoglobin to exist and to be able to take the oxygen to different parts of the body. So think of hemoglobin as your car. Think of iron more as your fuel, and oxygen is the essential passenger that needs to get to different parts of the body, right? So you have the car, which, and we'll get into details how your car could break down, but you have the car in your body, you have your hemoglobin. You need the iron as a fuel to be able to take the oxygen to different parts of the body. If there's no fuel, you're not getting anywhere. So iron deficiency, ID, just to make it shorter, occurs when the body's needs of iron exceeds the iron stores. Pretty simple, a balancing statement, right? When your need is more than what your stores is, of course, you're deficient. It is actually the most common nutrient deficiency out there, which is a pretty profound statement in itself because one might think that, you get enough iron, it's an element, it could be out there anywhere, but it's the most common nutrient deficiency. Iron deficiency ranges from depleted iron stores without functional impact and health impacts with anemia. So a lot of people could be iron deficient and they may not show any signs and symptoms and their daily functions may not get affected, but at the same time a lot of people will show severe signs and symptoms like anemia. So understanding anemia a little bit better, there are about 400 different types of anemias. And I had to do a double take when I read that too, because 400 just seems like a way a lot. But we're going to be focusing on one specific type today. Just to make things a bit simple, they've divided the different 400 types of anemia into 3 categories, depending on what causes that type of anemia. Blood loss. So we're talking about red blood cells, which are a part of the blood. If blood is lost, of course, you're going to lose your hemoglobin as well. Erythrocytes, which was the red blood cells destruction, and hemolytic anemia is one of the classic examples of this, so we've put it right there. If your red blood cells are destroyed, of course, you're going to lose your hemoglobin and you can get into anemia. And inadequate red blood cell production. So again, we're pegging this whole conversation back to the red blood cells where the hemoglobin's housed. If you lose them because you've lost blood, you could get anemia. If you've lost them because they were not produced enough, of course, you're not going to have enough hemoglobin. And again, if you're not just producing enough red blood cells, then again, you're not going to have enough hemoglobin. So if you have anemia because you've had a lot of blood loss, what are things that could cause that? So chronic bleeding of any type could cause this. Conditions that may cause these are a lot of people have been diagnosed with things like gastric ulcers, hemorrhoids, gastric cancers, and things like those, where blood loss can happen within their systems, and that blood loss could lead to anemia. Other things that we come across are things like excessive menstrual bleeding or childbirth, during which women may lose blood, which could cause anemia. The second type that we touched on was anemia caused by red blood cells destruction. Hemolytic anemia, again, was one of the examples. And when the red blood cells are very fragile and they cannot withstand the daily routine that they have to go through within cells. Because, try and envision this. The cells don't just sit there in our blood and do nothing. They're traveling, they're doing different functions. They have their whole schedule set up of things that they need to be doing. So when they're not able to go through this daily function without their form or structure being changed or destroyed, that means they're not well enough and they get destroyed. That's when the premature rupture happens and can lead to a cause of anemia. Hemolytic anemia, again, can be present at birth, so it can be with you when you are developing as a fetus. And known causes that may include these are genetic conditions like sickle cell anemia and thalassemia, and sometimes there's some other causes too, and some may not even be known. Now moving on to the third type of anemia, anemia caused by inadequate or faulty red blood cell production. Causes associated with these causes of anemia include the following: sickle cell anemia, very widely seen; iron-deficiency anemia, which is going to be our focus of today's conversation; vitamin deficiency, so if you're just not taking enough, you won't be able to get your iron enough; and bone marrow or stem cell problems, because we did discuss that iron is stored in your bone marrow and stem cells. So moving on to iron-deficiency anemia. Now, the picture here is very interesting, and I think that kind of tells a story in itself, because it's a picture of a hemoglobin. It's more like a horseshoe kind of a structure, four of horseshoe put together, and it has an iron in it, and that's where the oxygen comes and binds. So as we were talking about, the hemoglobin, the red part, the horseshoe structure kind of a thing, is your car. The iron is your fuel that you've put in there, and then comes and sits the passenger, that's the oxygen, our very important passenger that needs to travel through the body to get all the functions going, right? So iron deficiency anemia occurs when there is not enough hemoglobin in the blood and there's too few red blood cells. So two parts of that statement. The red blood cells where the hemoglobin is housed is less, and at the same time, hemoglobin, which is responsible for making the oxygen travel through the body, is less as well. So what causes this kind of iron deficiency anemia, which we're trying to discuss today? Increased demands of iron. Growing, I have an 11-month-old son, and I've seen him from birth till today, and there's so much change. And from there on forward, there's going to be further changes that one sees in the body. As we go through this change in our life, our body's going to demand different things in different amounts as we grow. So as those demands increase, if you're not able to fulfill those, you can end up having anemia, simple enough. So rapid growth, especially when you're an infant or an adolescent, that's when you need extra iron for being able to grow and take the oxygen through your body. That's one situation where you've got to be a little bit more careful. Pregnancy is another one, just because you have more blood and you need to be able to take the oxygen through that blood. Increased iron loss, so we do lose iron through our body as well through some functions, so being able to match that loss so that you don't go into deficit. Chronic blood loss, we did discuss some causes for it. Menses, very daily stuff seen by females, so we got to watch our loss of iron there too. Acute blood loss, let's say you had a major accident, a lot of blood got lost, and blood donation. So if you're donating blood on a regular basis, you might want to check your hemoglobin as well. Or the third cause, the obvious one, decreased intake or absorption of iron. So if you're just not taking enough and everything else is fine and dandy, but there's just not enough supply, then of course you're going to be short of iron in your body. Major cause that we see very often, especially myself as a dietitian, inadequate diet. If you're not taking enough food from that is going to give you iron, you may end up with depleted stores. Malabsorption from diseases. Crohn's disease is one of the major culprits in this one. People who have Crohn's disease may not be able to absorb enough iron even if they're eating enough. Sometimes people after surgery are not able to absorb enough because absorption happens in the small intestine. If that part is taken away by surgery, you're not going to be able to absorb your iron. And inflammation at times, acute or chronic, can cause not getting enough iron as well. So who is at risk? Any ideas? Women? Do we all agree on that one? Yeah? Elderly? Yeah? Vegetarians? Yeah? Absolutely. You guys are bang on with this. So individuals with inadequate iron stores during a stage of high iron demand. It's a very bookish way to say it, but basically saying when you need more, as we talked about during infancy, during pregnancy, when you need extra iron in your body and you're not able to get it, you will be at higher risk of getting iron-deficiency anemia. Women of childbearing age and during menstruation. Prenatal as well as postpartum requirements, they have higher requirements. Children are actually prone to iron-deficiency anemia as well because of low intake of iron-rich foods. I'm sure everybody who has kids here, if your kid eats spinach, you are blessed, I must say. Vegetarians, we did touch on that. They do have very common seen to have low iron stores. That's because we'll get into details of what the statement says, that vegetarians have a low bioavailable source of iron in their food. So some symptoms that a lot of times when you're at the pharmacy and a client walks in saying, this is what I feel, this is how things are, this is what's going on with me. These kind of, stand out as symptoms to see that one may have anemia. General fatigue, dizziness. Fainting is an extreme case, but generally, people feel fatigue, dizziness, lower blood pressure, palpitations in the heart, they'll feel it more. Rapid heart rate, their heart beats much faster than the normal. Chest pain and angina, again, these are severe cases where chest pain or angina may happen due to anemia. Spleen enlargement is sometimes seen due to anemia as well. Yellowing of the eyes, there's a reddish tint and a hue to your eyes where even to your skin that you have enough iron in your body. When people are anemic, that is taken away. Skin, again, paleness, coldness, and yellowing of the skin is seen. Shortness of breath, and that came up initially as well, somebody said that. Weakness of the muscles, they always feel as if they're very weak, very tired, and changes in color of stool, that is also seen due to anemia. Now this diagram here kind of shows how iron stores deplete over time and how anemia progresses. So the first one where the whole column's full of red color is where your storage iron is full and your transport iron, the iron that you're using on a daily basis, is also full. The second one is where your iron stores is depleted, whereas your transport or functional iron is still full. So your body's going to deplete the stores, but it's going to keep the daily functions going. So that's when you will see low ferritin levels, and I'm going to talk a little bit more about labs, but that's typically how your body's going to react to it, saying, okay, let me use a little bit from my safety deposit box, let me use a little bit from my storage, and get the daily functions, keep them going, and that's how your storage iron will deplete first. Moving forward, your transport iron slowly and steadily starts depleting too, and in the last one, it's a full-blown iron deficiency anemia where your storage is totally empty, and at the same time your transport and functional iron is as well pretty low, less than half as well. So this slide is also trying to point out to the regular blood work that's typically done with people who are diagnosed with anemia. A lot of times you will see that the doctor orders a ferritin level or hemoglobin levels. So yes, hemoglobin levels definitely do point out to anemia, but something to keep in perspective of what ferritin levels mean as well. Ferritin levels show nothing else but the storage form of iron in your body, and hemoglobin is more towards the everyday use part of the iron that the body has. These are reference ranges if you ever need to talk about these or look at somebody's blood work, just to keep at the back of your mind of what the reference ranges would look like. For hemoglobin, for an adult female about 19 years of age, would be 115 to 116 grams per liter, and same age group for males would be 135 to 180 grams per liter. Now, mind you, the range for males is higher, but the needs in females is typically seen to be higher because there is a monthly blood loss seen in that age group of women. Same thing for ferritin. The regular reference range of anybody about 19 years of age would be greater than or equal to 15 micrograms per liter. What does this ferritin level mean? Because you may not always either just get higher than 15 or lower than 15. They'll give you a range of numbers. If you're anything lower than 15, then you know that you have iron deficiency anemia. If you're between 15 to 49, then you know you're probably there. 50 to 100, possibly iron deficiency anemia, and anything greater than 100 micrograms, iron deficiency is unlikely. So how much iron is needed? A cup of spinach a day does the job? Popeye would agree. No? So the recommended daily allowance for iron depends on your age and your gender, of course. For most people between 19 to 49, the adults would be 8 milligrams for men versus 18 milligrams for women. It's quite a bit, 10 extra milligrams, more than double for women. And in pregnancy, if you see, that goes even higher, so 27 milligrams for a pregnant woman. Now, mind you, for anybody who's about 50 years of age, between men and women, the requirements are same, because by then most women would be hitting menopause, and the loss is reduced. So something to keep in mind of how much you need. When iron stores are very low, therapy is initiated at one point or the other. Most common factors to keep in mind when therapy is initiated would be patient's overall health. If anemia is your only problem and you're fine and dandy and healthy otherwise, the doctor might give you sometimes saying, eat more iron-rich food and we'll see how it goes, versus just starting you on an iron supplement, versus they may also look at the reason for the hemoglobin or ferritin to be low. And the reasons are something that we talked about. Did you have a surgery where you lost blood? So they might give you some time to just recover and get better, versus they know you're pregnant and that's why your hemoglobin is probably shooting low, so they might introduce a therapy right away. So those are the factors that they would want to look at before they initiate a third therapy. And most physicians would follow up every 3 months. Again, everybody has a different practice, how they want to follow up, but mostly they would want to follow up every 3 months. So what does 1 milligram of iron look like? We talked about women needing 18 and men needing 8. What does 1 look like? So half a cup of cooked spinach has 3.4 milligrams of iron, versus 1 full cup of raw spinach has not even 1 milligram of iron. So everybody who likes eating a raw spinach salad thinking they're doing a great deal, yes you are, but if you're looking for iron, cook it up. It's better to have it that way. So iron from food, that's where my forte starts. There are 2 types of irons found in food, just to make things a little bit more complex. So heme iron and non-heme iron. So there are 2 different types of irons found in food. I'm sure we've heard of these terms before. We'll just discuss these a little bit more in detail. Heme iron is found in animal foods such as meat, seafood, poultry, and eggs. So that's why most people associate red meat with anemia or iron needing. Heme iron is more bioavailable to the body than the non-heme iron, meaning to say your body's happier and finds it easier to absorb the heme form of iron. It can quickly absorb it up and get it back into circulation. The mechanism by which heme iron is absorbed by the body is independent of the intestinal pH, therefore making it more efficient for that absorption rather than the non-heme iron. as I mentioned briefly earlier, that the iron is absorbed in the intestine. So what pH the juices in the intestine are can hamper the absorptions of things in there. But luckily enough, heme iron does not depend on the pH of the intestines for what changes would it bring for absorption. So it doesn't matter what the intestine is up to, it gets absorbed right away, almost 100%, and it's on its way. The binding capacity and uptake of heme iron only depends on its receptors, and it's positively correlated with the increasing iron deficiency. So, meaning to say, if you're really low in iron and if you eat a nice piece of steak, most of it is going to get absorbed. Whereas if you don't need that much iron and you do eat a piece of steak, only what is needed is going to get absorbed and the rest is going to be just eliminated. So, the lower your stores are, the more your body's going to absorb. Non-heme iron is the other type of iron found in food. It's found in plant foods for all the vegetarians who are known to be low in iron. Things like legumes, all kind of beans and lentils, enriched grain products, nuts, seeds, and some vegetables also have the non-heme iron. It is present in ferrous form, found in nature, and the ferric form in the alkaline pH of the intestine. So when it enters the intestine, the pH of the intestine changes the form of this type of iron, and that is what makes it less bioavailable, because it needs to be converted back to be able to get absorbed. And in the process of it going through all these changing before it gets absorbed, it creates a byproduct, which our body does not like. These byproducts that it creates in the body, the ferrous hydroxides, that is responsible for causing the constipation and the stomach upset a lot of people feel with iron. You'll often hear people say, oh, I had a nice spinach salad, but you know what? I feel as if my stomach's not happy after that. And that's probably because of this reason, that the non-heme iron found in the spinach had to go through conversion to be able to absorb. And as a part of that, a byproduct was created, the ferrous hydroxide, which can cause stomach upset and diarrhea. Now, I'm not trying to say that every vegetarian need to give up their spinach salad and move to eating a steak. That's not what my agenda is here. But just to be aware that excess iron intake can cause these things. Now, what do we do? How are we going to help the vegetarians ensure that whatever they're eating, whatever they can absorb from the non-heme sources is up for absorption? Their absorption of the non-heme iron can be enhanced by eating certain foods with the non-heme iron foods. And that is why they say add a little bit of lime or orange juice to your iron foods and you'll get it better. So vitamin C is what helps the conversion, and that's how you'll be able to absorb it better. So any foods like the peppers, especially now it's summertime, any yellow, green, or red bell peppers would be great. Broccoli, Brussels sprouts, snow peas, and for that matter, as I said, a lemon or a lime could do the job as well. Iron therapy. Now we're moving into more of the, the clinical sides of things rather than just the nutrition. This was about food. Food's not going to solve your issues. You're really low. That's when we move into therapy. It's prescribed for a drastically higher iron requirement or iron malabsorption or failure of oral iron therapy. So that's when the parenteral therapy is done. A very high iron demand occurs when body loss surpasses the absorption capacity of iron. Your body is trying to absorb as much as it can, let's say 100%, but your body's need is just way more than that because of a loss, because of malabsorption, because of whatever reason. That is when a parenteral therapy may be started. An IV or an IM may be administered, more expensive than the oral therapy, just something to keep in mind. Allergic reactions, sometimes fatal, are the most common type of side effects associated with parenteral iron therapy. Now we're going to talk about the oral therapy for iron. It's the initial approach to treatment when the food front fails. Non-heme products such as ferrous fumarate and so on and so forth, you're all pharmacists, you're very comfortable with these terms. These are the salts which are mostly used. However, they are reduced absorption and a higher incidence of side effects. And I'm going to get a pharmacist up here to speak a little bit more about this slide because she may be able to do more justice to it than a nutritionist can. Thanks, Mindy.
Hemrefer does not need any conversion whatsoever to be absorbed. So you have no conversion, you have no residue. So no residue, you have no accumulation in the GI tract, no constipation, no stomach upset. So that's like the nice summary of why a heme iron polypeptide would be a better iron supplement as opposed to the salts. That's like the quick version of it. It doesn't require, so like I was saying, it doesn't require any conversion for absorption. So that's our recommendation. All right, thanks a lot.